My options were simply this. I can simply prepare him for death or work hard to help him preserve his life. A 57-year-old man presented to our center on May 14th of 2020. 2 years prior, he had been told he needed a heart transplant. Other medical problems included diabetes, hypertension, gouty arthritis, and sleep apnea. He had had symptoms of mild shortness of breath and chest discomfort over a 6-month period of time. He had not seen his cardiologist in this time period. He had only received telephone visits and medication refills. On March 15th of 2020, a worldwide pandemic hit the United States, causing businesses to shut down, including non-emergent medical treatment centers. Shortly after the shutdown, our patient began having progressively worsening symptoms of chest discomfort and shortness of breath. He desperately reached out to his primary care physician and cardiologist in his hometown, only to find out that their offices were closed. He found us through an online search, and out of desperation, he flew 2,000 miles from the East Coast to save his own life. Upon arrival to our clinic, the patient had symptoms of chest discomfort, shortness of breath, and fatigue. On vital signs, his blood pressure was 96/48 millimeters of mercury, with a heart rate of 78 beats per minute. We performed an ultrasound of the heart, and it showed an ejection fraction of 25 to 30%. The patient was taking 11 prescription medications. After my initial evaluation, I became very concerned that this patient was severely dehydrated and was possibly in early cardiogenic shock. Cardiogenic shock is a condition where you have severely low blood pressure and circulation. My goodness, this man with such severe heart disease had gone far too long without medical care, and he's extremely ill. Then a gloomy thought occurred to me that not every medical story has a happy ending. I realized we had to get to work immediately. I consulted our culinary team, and we designed a hydrating antioxidant meal plan, food levels 0 to 3. We immediately began weaning his medication by discontinuing the insulin and cutting the diuretics by half. On a follow-up telephone visit, the patient reported not having symptoms of shortness of breath or chest discomfort since his arrival. He also noticed increased bowel movements since being on the nutrition plan. These were both encouraging signs. However, we were not out of the woods yet. The initial hopes that we had were lost after seeing the patient 1 week later. Upon follow-up visit at our center, he reported having symptoms of increased dizziness with recurrence of shortness of breath at rest and while walking. He stated that his bowel movements had become painful and bloody, and his blood tests showed him to be mildly anemic, and the findings were that of end-stage kidney disease. My worst concerns had been realized, and his kidneys were simply dead on arrival. Based on this evaluation, we decided to ramp up our treatment plan. We immediately started him on intravenous hydration with 1.5 liters of normal saline and intravenous magnesium. We discontinued all of this medication because its baseline blood work did not indicate an urgent need for any of them. He was discharged from the center with a scheduled follow-up office visit 1 day later. The next day, he presented to the clinic with recurrence of shortness of breath, lightheadedness, and extreme fatigue. The improvements that he had the day before were only temporary. It was clear that this patient was remaining in cardiogenic shock. Additionally, he was in a condition known as cardiorenal syndrome. Cardiorenal syndrome is a condition where you have simultaneous failure of the heart and kidneys, and I had to admit him to the hospital immediately. The standard of care recommendation for someone in his condition would be to refer him for an LVAD placement in preparation for heart transplant. An alternative to these aggressive therapies would be to simply refer him for hospice care and prepare him for a peaceful death. I was also emotionally torn. Recommending a heart transplant or hemodialysis were not practical solutions given the circumstances of the pandemic and his need to travel back to the East Coast. I had a strong feeling that I could help him turn his condition around. I started him on a special intravenous medication known as milrinone. Unfortunately, we had to discontinue the milrinone because it worsened his heart condition, resulting in a worsening cardiac arrhythmia. Initial cardiac studies done in the hospital showed that his heart was weaker than studies that were done 1 week earlier. Simply put, this man was much sicker than we originally thought. We were simply running out of options. We were in a do-or-die situation. It was at this point I went into deep thought and contemplation and made the following decision. I decided to stay with the natural integrative treatment plan with one simple modification. We continued the raw detox nutrition plan and had food shipped from our center to the hospital. We also continued the aggressive intravenous hydration with one additional ingredient, sodium bicarbonate. Sodium bicarbonate is a simple chemical compound that many of you know as baking soda. It contains a sodium molecule and a bicarbonate molecule. In its intravenous form, it is very useful in neutralizing increased amounts of acid in the blood. Within 48 hours of this treatment plan, we noticed the following changes. His dizziness and shortness of breath were subsiding. His energy level was improving and the blood acid levels were decreasing. But more importantly, his kidneys were coming alive. These improvements continued throughout the remainder of his hospitalization, which was only 6.5 days. Upon being discharged from the hospital, the patient was seen at our outpatient center. We followed him for another 2 weeks and saw further improvement in his heart and kidney function prior to him returning home. So what happened to this patient? Simply put, he was over-medicated and severely dehydrated. These two factors alone nearly led to his death. However, in this case, a simple integrative treatment plan consisting of a raw detox diet, oral and intravenous hydration with the addition of sodium bicarbonate was enough to help this patient turn around. Thanks for watching. If you got value out of this video, please like it, subscribe, and hit the notification button to see our next show.